everything that Dr. Lee talked about for almost every surgery I've gone through. I've had 5/7, 12/7, cross-facial transfer, which is a two-stage process.
And I forgot to say that I did that surgery for him. So
yeah, and then you know, I've had the nerve taken out of my leg, as she mentioned, and all those dead spots on my leg are there. Nice little patch out of my leg here that kind of gives me a little lift in my cheek. With everything that she's done, I had House-Brackman scale 6 when I started all this. I can now, if you can see this, people online, you were not going to be able to see this, but I can retract. I'm not biting. Before I could only bite, and I would get some retraction. Now I can get movement. I can't. We're going to talk more about getting my left side up to show my teeth with my braces that I had to get, because nobody talked about jaw realignment, which is going to then break down your jawbone, which required me to have to go and get braces. So all these things that I had to learn. So my part of the presentation, everyone, it's been 3.5 years, actually to the day, and it feels like it's been not a minute. It's actually, that's a line from Maverick, Top Gun. I like that show. So and this is part, what I'm sharing with you is not the nitty gritty. You can go to the Caring Bridge site and get that part of my story. This is a story about how my clinical lens shifted 180 degrees. And my hope is that I can help you with that. So I want to talk to you about a little bit about what your patients may be really experiencing that you may not be aware of. As a clinician myself, I know it's easy to walk in, you read the docs, you have the diagnosis after an assessment, and you've got your treatment protocol kind of planned out, and you go and you do your job. Some of it has to do with how we approach things. I think that insurance billing and billable hours create some of this. I think we get into routines. We work with families and patients that, and I'm sure the medical community is no different, that anything we say, they're gonna go okay. But there's more to this story. There's layers to this onion. So I want to talk about also medical self-advocacy, which is huge. Everything that Dr. Lee talked about, nobody told me about. Every step of the way, I found it. And that doesn't make me great. It makes me stubborn. It makes me know that I was trained well as a speech pathologist. I did the homework, I went to the literature, went to the research, and I advocated. And a lot of people don't like that. I'm not very nice when it gets to that point. In fact, I guarantee you my file has more red flags in it than most. And I don't apologize for it. It's my body, it's my life. Then I'm going to talk about a little bit, some comments that will just make you shake your head. And I'm going to share those because I've heard them a dozen times, minimum. It's what your patients hear. And that's what I want to share with you. Because it'll give you a perspective of what they're going through and how they're spoken to. And it's unfortunate. I don't think we do it in our world, but a lot of people in the medical and rehab world do these things. And then resources, and because I don't want to forget, the handout that you have, that you get access to, we put a lot of hot links on there, a lot of information that can be very helpful. So I'd encourage you to go through those. One of the biggest things I've taken away from this is a shift in my perspective. And really, isn't that what it's about? That's life. Life is about perspective. And it comes down to a simple mindset, choice. Choice in terms of how you're going to respond to an event that we all are going to experience. My experience isn't unique. I can tell you one thing that's very sure in life. One, we're going to get older. And two, somebody, either you or you know or a family member is going to experience something that's going to require care. There's no way around that. And so when you get to that point, you can go down two paths. One that's going to be very hard and frustrating, or you have the choice to shift your lens and think about perspective. And that's what I really want to share with you, because life changes, and it can change any day. That's the one thing that's probably the least discriminatory in our world, is that we're all going to be touched by this in some manner. So, part that I want to share right here has to do with the grieving process, which will impact treatment at a huge level. Where that individual is on that continuum will dictate how they hear you, will dictate how they follow through, will dictate their view on the importance. These are just the things that I've gone through that it all seems manageable until it's you. Hearing loss, tinnitus, I mean right now, if I put it on a scale from 1 to 10, I have had it at a 9.5 where I'm on the floor crying. Right now I'm probably at a 7, and that's from the time I get up in the morning until I go to bed. Thanks, Mayor. Cognitive load, big issue. Vestibular and vision. All of these create fatigue, and the fatigue makes it hard to get out of bed, to get motivated, to do life. Then we go over to fear, because now my life's changed, the person's life's changed, your abilities are compromised, your career and finances may be compromised. And the big one that really hit me hard was my purpose and my relevance of what I thought was my purpose and relevance were stripped of me in a moment. I had no choice in that. I'm going to come back to that. So the fear then contributes to the twins, depression and anxiety. Common outcomes, even for hearing loss. Huge body of literature on the social, psychosocial impact of hearing loss that I really would encourage anybody to review, because isolation, depression, anxiety are all correlates to hearing loss, whether it's unilateral or bilateral, or as we get older and we see a decline. The stages of grief and change and loss, because that's the big one, right? My life's different now, and I hated it for years, the term my new normal, because that means my old normal, that's gone. I'm still working on that one. And then relationships, they change. Friends, or people who thought were friends, they disappear. You gain the other ones that step up, and they're there. At least in my situation. And those people that step up and are there, it doesn't take a whole lot, but I tell you, I'm loyal to the end. This is what it looks like, the long tail of recovery. This right here on the left side, expectations, this is kind of what we think clinically, right? Treatment, gains, right? We do our frequency counts, right? Suddenly it's 60%, now I get 70%. The reality is on the other side. It's not linear, and it comes back around like the stages of grief, where myself, shock, denial, anger, and bargaining, I've been at that dinner table, I can't even count how many times. It's a hard one, and it leads to the depression. But then you kind of come out of it, at least I do, because I refuse to sit back. Maybe that's just how I'm wired. You get to a problem-solving stage where you have to figure out how to live. And again, we're back to perspective. We're back to perspective and the purpose and relevance of what this whole journey is about. And here's the part I want to share with you as clinicians. This is all stuff that should be included in treatment. You should fold this in. Because if your clients if you're not addressing this and they're not making gains, I guarantee it's because of this. Most likely. It's something that's a little deeper than you're addressing. And we're going to talk about that in just a second. Medical advocacy is huge. I'm a huge believer. In fact, I'm probably a little more pitbull about it, but I've had to be. Because nobody has, and maybe that's the difference of being 56 years old and single. There's nobody sitting next to you. Nobody to ask questions for you. Nobody to step up and help you. So medical advocacy, part of the issues that I would say that is important to understand when you are fighting for yourself, your family, or your clients, is that in our field, as well as other fields, medical fields no different. It's a very silo-based disciplines. Everybody has their specialty. Once they're done with their part, you're out the door. Nobody's doing the handoff, which kind of drops down to the medical advocate and medical social worker. If you don't know this, every hospital has a medical social worker that's available that you should request. Now, where the ball gets dropped, because I did this at UC San Francisco and begged for it before I started. 2 weeks after my surgery, I got a call. Hey, we hear you need me. I'm like 2 weeks ago, when everything went sideways. So there are holes in the system, but you have to advocate. Being a good consumer of medical information, insurance, and your own health. And don't be afraid to ask questions. Get more than one opinion. And the last one, don't be afraid to ask questions. I'll tell you that. And some people don't like that. I have fired 3 neurologists, 3 ophthalmologists, a neuro-ophthalmologist, a neuro-otologist, not this one. I have no problem advocating for myself again. I start my conversations off like this right now. I have to learn this. I said, let's start before we have this conversation. I'm gonna be your best patient or your worst. And it's all predicated on this. If you don't listen to what I'm sharing and you speak to me in a condescending manner, it's gonna go bad very quickly. And once I put that on the table, not as harsh as that, I had a conversation like this with Dr. Loyal Lee when we started.
I don't remember.
You remember that?
No.
Oh,
it
wow.
was so nice.
I had softened up by then. She caught me on a good day. But the part that I want to talk about from a treatment standpoint that widened my lens really quickly is that there are 2 treatment paradigms that if you're not familiar with, you should go back and look these up, and you can find this information in ASHA journals. One's called the Rehabilitation Treatment Taxonomy, from an article I have posted right there. The RTT, what it really talks about are ingredients of like what the speech path is doing, and then the mechanism of change to get to the target that you're addressing. Usually the mechanism of change has to do with a behavioral focus, cognitive focus, or physiological focus. One that's many times missed is the psychological, which I think is the most important to get to address the other ones. If you're not familiar with the research in our field now, finally, on cognitive behavioral therapy, I would strongly suggest that you look into that, because that's the way that you can bring this into your treatment interventions with your clients that can address this piece. And then the communication participation is where maybe it's, talk to your client about what their goals are. I know you do, but you'd be surprised how many don't, right? Again, I'm 56 years old. Now I'm full facial paralysis. I'm single. My focus would be, hey, it'd be great to have a date one day. I'm pretty sensitive about how I look. I won't even go to a restaurant because the food's falling out of my mouth and so is the water. That's real. And that's lonely. If you're not familiar with the ASHA physician statement on counseling, you can find it on their website. And there are ICD-10 codes that you can bill for counseling. Be aware of those. Sometimes I think people shy away from that because they don't think it's billable. And unfortunately, the billing drives a lot. Okay, I know my minutes are coming to an end, but we're close. Say what? These are literally things I've heard in the last 3.5 years. There's nothing wrong with you, you're just getting older. That was from my neuro-otologist who's no longer working with me. This guy's the best. Oh, this was when I was getting my bedside after my craniotomy. You're an SLP? A professor? You want to do your own bedside? Now I'm on oxy, I'm in pain, I'm swollen. I'm like, are you a CF? It's interesting what people say, right? Oh, this came from a neuropsychologist, but I'd say never go to this guy, but yeah, but your PhD is only in education. When I was talking about my background and my knowledge level and and then he goes, did you know that people with low IQs typically go into education? Followed with, after 2 hours of being assessed, by saying words and doing all these assessments with full paralysis, he goes, Frank, stop mumbling. And I go, I'm not. He goes, yes, you are. And that's when I had to really educate him on who was the speech pathologist in the room and the impact of fatigue on muscle use. And then this one is a good one. It won't help when I asked about facial reanimation surgery. And this one is always kind of a real life one. Yeah, a Gen Zer. I was in line to get a drink at a music festival. I'm just standing there minding my own business. She looks at me and she goes, "What's wrong with your face?" And I go, "Most people don't ask that kind of question." And she goes, "Yeah, but what's wrong with your face?" I'm like, wow, you need some social communication intervention. So this is the kind of thing that your patients are hearing. Not when they're with you, but when they're out in the world, you know. It gets to them. It's hard. It reminds them of how limited some of their life has become. And then we're back to this perspective. And it's about a choice. I think of it now versus life altering, is it life accessing? I thought my life and my career was over. What I didn't realize is that I think it saved me. The vestibular Schwannoma took me out of a situation where I was working that things just weren't going well, and just life post-COVID, it was COVID, right? A lot of bad stuff. But it changed my lens, changed my perspective. I started asking some other questions about what was really important. And what was really hard is that at this point in the beginning, I thought I lost my purpose and my relevance. Because when we do our jobs, many times we think that our purpose and our relevance is to do our clinical work and help our patients. And I get that. My daughter, who's in the audience, her mother, also a speech pathologist, great speech path, Van Haddam Award winner. She used to share that I define myself by my career, my purpose and my relevance. And all I've ever wanted to do was teach, pay forward, and contribute to this discipline that's given me everything. So I thought I lost that until I shifted my lens. And 3.5 years later, standing here, teaching, paying forward, and hopefully elevating our discipline with new information, and information that both my esteemed colleagues have presented. I go back to some quotes because quotes help me. Viktor Frankl talks about perspective a lot, talking about choice. This guy had a much worse deal than I ever did. It's really that simple and hard. But it's our choice that we can make. We're going to come to questions in just a second. These are pictures of me, Dr. Hodgson, cutting into me. There's my vestibular Schwannoma. There's me looking all piratey that I had to wear an eye patch for a couple years. And then that was me with my brother who's in the audience on his boat this summer. You can find all this information, and we're going to do a couple quick questions, but I just want to say a couple of thank yous to some significant people in my life. First one is Dr. Sandy Ibarra. She's my audiologist. She caught it. If she didn't catch it, it would have grown more. It was already compressing into my brainstem. So I don't know what it would look like. She saved my life. Hearing Associates, where she owned and worked for many years. My two colleagues to my right have been everything in my life. My daughter, my brothers, my family. Dr. Mary Mitchell in the audience at Pacific University, who brought me out of the darkness of feeling like I had no purpose or relevance. And then one last person who gave me hope. She probably, I don't know if she's listening, but her name's Lucy. And hope is a really bad thing to lose. And when you don't have hope, it's hard to move forward. So at the very least, she's given me that, and I appreciate that. So I know time's running, but if you guys have questions, feel free to ask, or you can catch us out in the hallway. If anybody has geez, they turned the software back. Thank you.